So you have now completed your emergency plan for your family. How about a plan for this family member? Protect your pets during a disaster by including them in your family's emergency plan. Start by making your pet a disaster kit. Put all paperwork into a large Ziploc bag, including a picture of you and your pet, your contact information, vaccination information, and special care instructions. In addition, you should pack certain items to help your pet during the emergency. A 7-day supply of food with bowls, a travel crate, and your pet's favorite toy. Remember, shelters are the place of last resort. Your plan should include being far away from the disaster's epicenter. But if you do find yourself at the shelter, know the rules. Once at the shelter, your pet will be placed in a designated animal section. This is for your pet's safety, as well as other shelter residents. Knowing the shelter rules helps everyone stay safe during an emergency. For more information about shelters, their location, rules, and how to get ready for a disaster, go to hcfl.gov/staysafe.
Good morning. I'd like to call to order today's meeting of the Board of County Commissioners. Before we get started, I want to personally thank the board members for making themselves available for this special meeting this morning. My soon to be 23 years on the board, this is only the second time that I can recall that we've asked for a special meeting. Both were necessary for different reasons. This one's highly unusual, but the sense of urgency necessitated the need to have this. So thank you for being available on our time off. But we're here to conduct a public hearing on the hospital-directed payment program annual non-ad valorem special assessment. At this time, Bonnie, would you like to introduce the item?
Thank you. We're going to turn this over to Kevin Wagner, who will give a brief description of the program.
Good morning, Kevin.
Good morning, Commissioners. Kevin Wagner, Healthcare Services Department. Again, this is a public hearing to consider the approval of the special assessment resolution and assessment role related to the hospital-directed payment program, referred to as DPP. This program is a supplemental program meant to bridge the difference between the Medicaid reimbursement rates and the actual cost of providing care by leveraging federal funds to increase the Medicaid managed care payments to hospitals providing the care to those patients. The DPP allows governments to establish the non-ad valorem special assessment that is levied solely on the property and or leased by hospitals. The approval of the special assessment resolution allows the county to collect the non-ad valorem assessment for the purpose of benefiting the assessed properties through enhanced Medicaid payments for local services. So what does that mean from a money standpoint? If approved, the special assessment will only be imposed against property owned and leased by the hospitals, as said earlier, will be calculated for each hospital based upon the rate of $67,609 per available inpatient bed and 1.17 of net outpatient revenue for each assessed property, and will be collected directly by billing each affected hospital. The total assessment amount is $359,799,513. Payments made to the hospitals will not be passed along to patients of the assessed hospitals as a surcharge or any other form of additional charge. The resolution is structured to include the county's costs associated with the development, levy, administration, and collection of the assessment. This assessment resolution has been noticed in accordance with the county's Local Provider Participation Fund Ordinance, Chapter 46, Article 7 of the Hillsborough County Code. This is a public hearing, and representatives from the hospitals are here for any questions.
All right, thank you, Mr. Wagner, for your explanation and presentation. Before I open the public hearing, as Mr. Wagner stated, we have a number of hospital executives, representatives that are here today. As you recall, during our last board meeting, many of them spoke during public comment. They've been advised today that they're more than welcome to speak again today. However, for the sake of brevity, it's probably not necessary. However, they are available should there be any questions. So with that, we'll open the public hearing. Would anyone like to speak at this time? If not, we'll close the public hearing. And then before I ask for a motion, I just want to ask Ms. Beck to confirm that this item requires 4 votes, not a simple majority.
You're absolutely correct, Commissioner. Because it's a resolution, it requires 4 affirmative votes to pass it.
Okay, thank you. Commissioner Myers, did you want to comment?
Can I get ready to make a motion?
You're more than welcome.
Okay. Good morning, Mr. Chair. First, I want to thank staff for rushing this item to us for approval. And I do agree with our chair coming in off of vacation. But more importantly is to thank the hospitals for all that you all do to support our clients that come in to your hospital for service. Therefore, I move for approval.
Second.
Okay, we've got a motion by Commissioner Myers, second Commissioner Cohen. Don't see anyone else in the queue. Please record your vote.
Motion carries 5-0.
Okay, with that, again, thank you everyone for being here, and our quickest meeting ever is now adjourned.
Excuse me, Mr. Chair. Matthew King had signed up to speak. I don't know if he's with a hospital.
I asked if anyone wanted to speak.
Right.
I did. I can waive that, or I can speak.
You can waive that.
Okay, I'll waive that.
All right, great. Thank you. All right, we're adjourned.